how was that living with that, watching someone that you obviously love very much going through this?
I had to fight a feeling of being helpless, and it took me a while to realize what I was up against.
When people think about caregiving, people think that they're signing this death sentence with their life.
In the middle of an attack, you were always in a fight or flight kind of mode. Kind of put on the armor and get ready to go in for the fight, do whatever is necessary to get her where she needs to be, talk to whatever doctor's necessary. The question was always, did porphyria cause the end of my marriage?
Welcome to Rarely Discussed, an American Porphyria Foundation podcast with your hosts, Andrew McManamon
And Nicole Castellano.
We both have porphyria, which is a rare disease. As scientifically different as rare diseases can be, we share many similarities on how it affects our lives.
We're here to open the discussion and give the Porphyria and Rare disease community a safe place to connect, learn, and heal. Being rare can feel lonely and isolating, but we're stronger together. Let's take a journey as we share our personal stories and have meaningful interviews with porphyria and rare disease experts and the patients and families impacted.
We'll talk diagnosis, treatment, misdiagnosis, managing daily life tips, ways to cope physically, mentally, and emotionally, and everything rare.
Welcome to Rarely Discussed. This is episode number 4, and we have a very special guest to talk a little bit on the caregiving side. So I thought, Nicole, you could introduce our guest today.
Yes, today we have a very special guest, Warren Hudson. He is our first caregiver, as Andrew said, and we're so excited to have you, Warren. Thank you so much for being here today. Warren cared for his ex-wife who had porphyria and for many years, and then stayed involved in porphyria and the APF afterwards, even after the marriage ended. He's originally from Austin, Texas, and now lives in Chicago and is the president of a mid-size accounting consulting firm in Florida. Warren has served on the board of the APF since 2000, the board of directors since 2009 in various roles. As a trustee, as a treasurer, and even chairman of the board. Prior to serving on the board, he also helped with legislation issues with the APF and volunteered for various projects since 2002. And there's also a great love story here. And Warren, through his work with the APF, one of the doctors that he got to know had introduced him to her friend Judith, and Warren and Judith started dating, and then they got married for about 10 years ago, and they just got married in 2022, so that's very exciting. His wife, Dr. Judith Hudson, hopefully we will have her on the show at some point. She is a psychologist specializing in chronic pain and addiction. She currently works for the VA, and she also serves on the APF Scientific Advisory Board since 2021. And her focus is in the neuroscience of pain and alternative treatments for chronic pain. So we're hoping to have her soon. But again, Warren, thanks for being here today. There are not enough words to express everything that you have done for the APF and through the APF for patients over 20 years. So I can't even thank you enough, but I think everyone's going to find your story very inspirational. I know I do. And so I'd love to hear how you kind of got started with everything.
Well, first off, I'll say that it never feels like I'm doing enough, but yeah, my story, it starts probably back in the 80s. And I'm sorry if it becomes a little bit too long, you guys let me know, but I met someone when I was 14 years old, and she was a very good friend of mine throughout my high school days. And I remember when we were in high school, she had a first cousin that ended up in the hospital in New York, and she was in ICU and paralyzed and doing just terribly. And, you know, when you're 14 years old, you listen to all this drama and you're paying attention to what's happening in your friends' lives. So a group of us were kind of captivated by this. And then we found out that A, her cousin lived, B, that she had this rare disease called acute intermittent porphyria. And the doctors in New York said, hey, you need to get the whole family tested. So my friend and her mom went off, got tested. And at the time in the 80s, it wasn't as cut and dry as it is now, they said it's suggestive for you having porphyria, and you're probably just a carrier, but you need to keep an eye on whether or not symptoms come up. And they told my friend, since she was only 14, that likely she wouldn't experience anything obvious at that point, but in her 20s, she needed to keep an eye on it. It turns out that her mom had been experiencing symptoms, but always discounted it as something else. Nevertheless, we went off after graduating, kind of led our own lives, and then came back together when we were about 30. And out of just circumstance, we kind of went from friendship to a romantic relationship and started dating in about 99, 2000, got married shortly after that. So 15 years after discovering that her cousin had acute intermittent porphyria, she started experiencing some problems. And apparently before she got with me, she was hospitalized several times with acute abdominal pain. And they said, well, it's probably feminine issues. So everything got discounted to fibroids, uterine cysts, those sorts of things. So she went under a couple of surgeries, kind of exploratory, looking for the endometriosis or the fibroids or whatever was there. And there was never anything that was really found. Nevertheless, we get together. We're living in San Antonio, Texas, and she starts having problems again. She does what she'd done before, told that she had, some sort of feminine issues. So she found a gynecologist, went to the gynecologist. Gynecologist says, of course, your cycle's irregular. You need a bunch of progesterone. So they loaded her up on a ton of progesterone. And as we all know, with acute intermittent porphyria, that's a key trigger. So she went downhill. I had somebody that was writhing in pain on the ground. I remembered back from high school, so did she. She said, I probably have this porphyria thing that I got tested for, and I've got a family history of it. So maybe we should do a little bit more experimentation. We got online, and this will tell you how big of nerds we were. We got online, looked up on the American Porphyria website, and we saw like jars of urine, and that, they turned dark when you exposed to sunlight. So we found a couple of empty jars, and I had to, of course, provide the control sample. And she provided the test sample, and we laid them outside on the deck. And sure enough, after a few hours, mine was just as it was when I put it in there, and hers was about the color of coffee. So we said, boy, that seems like a pretty positive indication that we might have a problem. So this is kind of an unorthodox diagnosis story, but we didn't really have a problem so much with diagnosis. I looked in the phone book and looked for hematologists. The first hematologist we found that had an open appointment, we took that. Turns out, I learned at that point that hematologists and oncologists are pretty much the same thing. So we went to a cancer clinic. She was seen by this hematologist, and just so happens he'd done his residency in Salt Lake City with someone named Dr. Kushner, who had been a longtime researcher and kind of pioneer in the study of porphyria. So when we sat across from him and said, look, here are the symptoms, she's got a family history of this, he was a little skeptical, but he actually knew what we were talking about. And he quickly gave us, I would say he took a very conservative approach to treatment. And he wanted to make sure we had positive tests first. So he began the Watson-Schwartz test. He got us in touch with Dr. Anderson out of UTMB in Galveston and sent a bunch of samples off to there. And the next thing you know, we've got positive test results for acute intermittent porphyria. And that kind of started the long road to where we are today, because at that point, we'd gotten in touch with Desiree Linehow, who was leading the American Porphyria Foundation at the time. And I started doing a bunch of research to see what we were dealing with. And so did my ex-wife at the time. So that was kind of our first introduction to porphyria in earnest and the foundation. So that's how I got involved back in about 2000, 2002, somewhere in that neighborhood.
That's great. Now, as far as once you knew that she had porphyria, um, what was it like, kind of day to day? You know, during attacks. Not out of attacks. Like, how was that living with that? Watching someone that you obviously love very much going through this, and like you said, you feel like you can never do too much. I know that when my mom had cancer, I felt the same way. So I'm just curious to know, like, what that was like for you.
Well, the first important lesson that I learned was just because you have a diagnosis doesn't mean everything is going to be okay. We could walk into an emergency room or another doctor with all of the test paperwork, phone numbers from every specialist that we'd talked to, everything that you can conceivably think of that would prove that you had porphyria, and they would look at you cross-eyed and still treat you like you were a pariah. So learning how to deal with new encounters was kind of the first problem. And I don't know, this is kind of a nuanced response, because in the beginning it was all about finding, where can we get treatment when we need it. And a lot of the hospitals around where we were more military based, and they didn't have a lot of experience with this kind of stuff. They were used to car accidents, gunshots, things like that. So if she was in a real crisis, going to the hospital was almost a secondary crisis. I mean, it was truly something that could, well, I have nightmares about it today, and I haven't been married to her for 14 years. So it's, I mean, it was a long and kind of treacherous road getting to how are we going to be able to take care of this when we need to, how are we going to be able to get emergency care, and how are we going to build up the resources necessary to make sure that we're in a good place and don't have to worry about just finding a spot to land in case she is in terrible pain, can't hold down food, a myriad of other problems. So that took a while, and we ended up having to move to Austin to find that. So 80 miles up the road from San Antonio. Honestly, the problem is that in the middle of an attack, you were always in a fight or flight kind of mode. So, or at least I was. You've got crisis comes up, you've got to kind of put on the armor and get ready to go in for the fight. Do whatever is necessary to get her where she needs to be, talk to whatever doctor's necessary. So it was kind of a roller coaster emotionally of going up, getting charged up, getting ready. And then in between attacks, honestly, I'm looking at the next one. I'm going, when's it going to hit? And trying to prepare myself and the house for having to go and do it all over again. There was one year, I mean, she was in the hospital for probably 24 weeks out of the year. And we had a couple of years that were around that. So
and then
it's
you
very
also
draining.
Oh, sorry, go ahead.
Go ahead.
Oh, no, I was going to say, you also so it sounds like it was just, even though the attacks weren't constant, the worry about it was. And did it, over time, were you able to find a place where people would listen and understand, and kind of look at everything that you had, and find a place where she could get treated when she was in an attack finally?
The strange thing is that you would think you would have a relationship with a hospital because you'd been there a few times. And inevitably, you'd end up having to go into the emergency room, and I would hear people talking in the hall saying, she's a drug seeker. He's enabling her, stuff like this. And it got to the point where if I heard that, I would actually challenge them and say, look, this is someone who's been in the hospital, in some cases, 24 weeks out of 52. So you should have a long record of this patient and what they've had to, what sort of treatment they've had to go through and their condition. All you would have to do is look in your own records to see that we're not out there looking for narcotics or anything else. I mean, the sad fact is that we had quite a bit of medication at home because we tried to treat things at home and tried to stay out of the hospital. And if we were looking for drugs, I had everything that we could possibly want on the shelf in the bedroom. We were at the hospital because that didn't work anymore, and we needed something that would be effective. So you're fighting a stigma in the medical institutions, and I understand they're seeing the worst of the worst every day. It's easy to get jaded. So I had to and my ex-wife had to adjust how we approached people. Even though it might have been a very emotional time, you had to fight that urge and throttle back the emotion, because the moment you kind of lose your cool, you get discounted very quickly. So it gives people an excuse not to listen to you. So we had to basically train ourselves to be very calm and methodical in how we approach things. She might have been feeling like she had hot daggers stabbing into her stomach, but she would try to keep a calm, cool demeanor. And oftentimes it didn't work, and I had to step in and kind of continue the conversation with the doctor. Or in some cases, she didn't make sense because she was in really bad shape. So both of us working together as a team had to approach the medical team in a very specific way to make sure that we got what we needed. I mean, you'd often end up spending hours, if not days, fighting against some sort of negative impression that you had created when you walked in the door, crying and carrying on. And it's unfortunate because you have to almost fight that urge to be human and react to pain and trauma just to be able to ensure that you get decent medical care.
I think
Now,
it's crazy because everybody thinks, oh, I'm going to go to the hospital to get help. And then, you go to the hospital. I mean, I know I've had issues similar to that as well as a patient, but, I think it's just a very important thing to highlight that you go for help, and not only do you not get help, you get questioned and almost maybe not ridiculed, but you're definitely basically being told that you're lying. And that's just got to be so difficult to control those emotions, especially while she's probably trying not to scream in pain. And then it just how that sounds just exhausting. I mean, how are you able to just kind of keep fighting and going in over and over and over? Because like, I know as a patient what that feels like, but as a caregiver, I would feel like as a patient, sometimes you don't know what's going on as much, and as a caregiver, you know exactly what's going on. And like, how was that for you to I know you're saying that you navigated it, but like, how hard was it to do?
I had to fight a feeling of being helpless, and it took me a while to realize what I was up against. And the first thing as a caregiver and a patient, you have to realize when you walk into an emergency room, your average emergency room doctor or hospitalist really has no idea what you're talking about when you say porphyria. In medical school, I've taken kind of an informal poll amongst doctor friends and some of these same emergency medical people and what have you. They say literally their exposure to porphyria might have been a paragraph in a textbook. So it's rare enough that it's not something that they're spending a lot of time studying. And unfortunately, the information that a lot of doctors have heard has been incorrect. So we tried to spend a lot of time educating when we went in. The only problem with that is that you run across certain people that feel like you're trying to preach to them and you're telling them they don't know what they're doing. And there's an ego issue at play, right? And you can't afford to get into some sort of who's right and who's wrong sort of match. But it became evident that oftentimes we walked into an emergency room with far more knowledge about the disease than the people who were there to treat us. And that was scary. Luckily, we got in with a hematologist who had escaped Katrina and ended up in Austin. And I'd say the best doctor is one who's willing to learn. And if they don't know something, they're willing to say they don't know it and they're willing to find out. And it may sound trite, but it took a long time to find that kind of individual. And I would highly suggest if there's someone you don't feel comfortable with, keep looking. They're out there. There are people who really want to learn and enjoy medicine for the sake of medicine. And he was a lifesaver. He also gave us access to an infusion clinic so that we were able to kind of ward off major attacks so that we didn't end up in the hospital as much. We spent a tremendous amount of time in the infusion clinic, but I would much rather have driven her back and forth to an infusion clinic than sit in a hospital for days. Now, did I answer the question or did I just veer off on a tangent?
No, that's perfect. It's great. How was there, so we talked about how kind of, or you talked about, I should say, how dealing with the hospitals and stuff, and that sounds like it was a really great relief. I know Andrew's felt that a lot where he's in there. We all have, where you feel like you know more than the doctors. And it is scary because you're like, how are you going to treat me? But I don't know if you guys feel the same, but it's like, if you just get what you need, you don't care. You're just like, I don't care if you have to find these ways to say what you know without like you said, with getting with someone's ego. Well, usually what other people, like you can't just, it's very hard to navigate. But as far as your relationship with your ex-wife with these problems, did like, and being a caregiver and having to deal with that, or even social issues, like not, like, I don't know, like I know a lot of patients, when you can't show up for things because you're not feeling well and stuff like that. As a patient, we always feel guilty that we're making people, that others around us, were ruining their fun because, we can't go. Like, how was it for you? Like either with your ex-wife or with family and friends and loved ones and things like that. Did it affect those relationships at all?
Oh, yeah, most definitely. You find out who your true friends are pretty quickly. I mean, the problem we had, and I can't even count the number of friends we lost and disappointed greatly because we weren't able to go on some trip, or we weren't able to make it out to the restaurant to see them that night, or something that seemed kind of small. You would try to explain, yes, she's got this rare disease. And oftentimes, most of our close friends knew that there was porphyria because I talked about it all the time. So, of course. So there was an expectation, or at least me, because I'm living it each and every day. I know the severity of what we're dealing with. I understand what we need to do day in and day out. They don't. And it took me a while to accept that. And it took me a while to accept the fact that some people don't see beyond themselves very much. And I mean, that's just an unfortunate social problem. So, yeah, we lost a lot of friends. We weren't able to do a lot of things. Even professionally, I ran into some problems because, I mean, when we got together, I was 30. So I'd already started a career. I'd been involved in something that looked like it was going to be what I would do probably for the rest of my life. So it wasn't something I could easily just adjust and change. And unfortunately, my career required a lot of travel. I had even been kind of sought after by a group out of the United Arab Emirates because a lot of what I do professionally is centers around development. So they're building a lot of stuff in the UAE, and they offered me a job to go over there for 5 years and look after the construction of like Ferrari World and the Louvre Abu Dhabi and all that kind of stuff, which was a pretty exciting opportunity, pretty lucrative, but her condition kept us from going because a lot of the medications that she required, their Ministry of Health would not allow into the country. And I had job offers from other large corporations that were going to put me on the road quite a bit. And I had to turn those down because I couldn't be in Kazakhstan, for 2 or 3 weeks, knowing that she may get sick and end up in the hospital. So it definitely affected the choices that I made from a career standpoint. It affected friendships. It affected just daily life. And I guess a prime example, because you asked this earlier, what was it between attacks? And I said, it's kind of like you're sitting there always waiting for the next one. And what I tried to do, and I don't know if I was very effective at this, I tried to encourage her to get out and do things that she enjoyed, because I watched someone who spent a lot of time in bed, in a hospital bed, in an infusion chair. And I'm thinking, would I want to get out there and continue that fight if that was my life? There's got to be something else. So she loved knitting. Said, go out and find some people to knit with. So she had a group of people that she liked to get together with and knit and crochet and things like that. She had other things that she liked to go out to do. So I was spending my time pushing her out, trying to get her to do normal things so that there was a reason to fight the next time. And this goes more to how it affected me. The problem is that while I was doing that for her, I was not doing the same for myself, because I had just been through this massive, cortisol spike. I had been in that fight or flight mode, and I'd come down, and the last thing I wanted to do was go out and do something. I wanted to curl up in a hole and recover. And the problem is, by the time I got to the point where I would want to go out and do something, we started the process again, because it was almost a monthly occurrence. So even though I was encouraging her to take care of herself, I was not doing the same for myself. And it affected me professionally. It affected me physically. I ended up getting very overweight and a host of other health problems. So it was, I might have been a good caregiver to her, but I was not a good caregiver because I was not taking care of myself. Am I getting off into an area that we're going to talk about in more detail?
No. You're good. Just keep going. I mean, talk about. I know that you spearheaded a caregiver support groups with the APF. I think to try to kind of help. I mean, how did you, with it affecting you so much? How are you able to just keep going? I mean, it sounds. And I don't want to say this because I know that I know that you wanted to do all these things, but it sounds exhausting. I mean, just in every sense, like even when you have any time to yourself, you're waiting, you're just trying to recover, and then probably catch up at work, and you just got all these things. Like how did you find the strength to kind of just keep going? I mean, it just sounds exhausting.
This is I don't know if you planned this, but it's an interesting segue. The reason I got interested in the subject of the caregiver for porphyria patients around 2009, the way I got involved with the board of directors is that we had been involved in a bunch of legislative kind of letter writing campaigns because of certain legislation that was going to affect the production of panhematin and some things they had proposed to change some of the Orphan Drug Act, things like that. When the Affordable Care Act came out, I'm one of the crazy people that actually sat down and read it. So I'd gone through the Affordable Care Act and I thought, okay, here's things that are going to affect this foundation. And these are things that have a potential impact on the patient population. And I wrote up a little white paper and I sent it to Desiree, and she shared it with the chairman at the time, was James Young. And I guess we can say James Young was the guitar player for Styx, since that's come out now. And James Young read the white paper and said, we need this guy on the board. So next thing I know, I'm getting a call from Desiree. Said, how would you like to be on the board of directors? Said, that'd be great. She said, well, James Young's going to be in Austin. He'd like to have breakfast with you. So I met him down there. They were on tour and they had a show in Austin. And I met him for breakfast that morning. And we didn't talk about rock and roll or anything like that. We talked about taking care of our wives. And we talked for probably 2.5 hours. And I'm sitting across from this rock star, and it clicks that, hey, we've gone through the exact same thing. He and I have entirely different lives, but we're worried about the same stuff. We're having to make it home from Timbuktu to take care of our wife and get her in the hospital. And I just thought how bizarre that was, right? That my first real heart-to-heart with a fellow caregiver was this. And I walked away with, it was almost cathartic. It was one of those things where realizing that there was somebody else that was going through the same thing, no matter what their lot in life was or their profession, they're experiencing the same hardships and they have the same concerns. And I said, that's really something we should probably focus on, because I have honestly always thought that the caregiver was kind of the silent vital sign. You can see how well a patient is going to do based upon their relationship with their caregiver and how much support they've got, whether it's one person or 5 people. And it occurred to me that I'd not been doing that well, and maybe it would help others if we all got together and talked about some of our problems. So that was A, how I got on the board, and B, how I got involved with trying to develop a caregiver support group. I will tell you some of the problems with a caregiver support group. First thing is that the time you reach out is generally in a crisis and you need help. And most people are not reaching out to help themselves. So I would say about 90% of any correspondence I got through the caregiver support group was, my husband, our wife, our child is experiencing XYZ. What should I do? Although not a bad thing to have, that was not the intent. Right. If you did find a group of folks that were willing to try to form something in order to kind of brainstorm on how to help yourself, how to help your significant other or what have you, they fell apart fairly quickly, because guess what? There's the next crisis that comes through. So people start peeling off and you lack some cohesion.
Sure.
What generally happened was one or two of us would end up forming a friendship, and that would kind of be my support group. I tried to provide that to others, but I never could get it to hold. And to be fair, I was also in the middle of crisis situations every 30 days or so. So it's not like I was able to really sit there, hone in and focus and try to keep people together. So that's where it went. I still think it would be a key thing to have for patients and their caregivers. I think it's an important thing that we as a community need to focus on, because those are the people by your side. They're in the trenches with you. And even though I was not the one that was experiencing the abdominal pain, getting the infusions, I was there next to the person doing that. I was there during all of it. So it's almost as if you've got this unholy window into almost hell at given points in time. And it's not an easy ride, but you do it because you're trying to help somebody. And I know that there are others out there that feel the same way. And I've been racking my mind on how you can develop something to help people like that. Because I know they need help. I needed help.
Right. Wow.
Sorry, I go on these long rambles and I forget what the original question was.
No. It's yeah. Did you have any help, or was it always on you? I'm sorry, Andrew. You should go ahead.
No, you're good.
Questions.
My mom helped at certain points in time. My ex-wife's mom passed away at a certain point, and we didn't have her family there, although she had a godmother that helped quite a bit. So between her godmother and my mom, we had some support outside of that. So if I was off traveling somewhere, I had some backup here and there. But usually, my mom's I won't say she's elderly, but my mom's old, and she's not able to sit there and spend 12 to 15 hours in a hospital room watching what's going on and making sure that people give her what she needs to be given, or doesn't give her something that's on the unapproved drug list, and that's a whole other issue. But basically watching the care and making sure.
I was going to ask that. Even if you have help, like, do they know they aren't? You just did so much research to figure out what was needed and to watch and to know what she could have, what she couldn't, what she needs, what she doesn't. Because even if you're in a hospital, that doctor may not be your doctor, so you still have to explain things. So was it hard when you were away? Was there a lot of anxiety knowing that, you knew God forbid something happened, it's great to have help, but you knew if you were there, obviously you would be, more equipped to handle things?
Well, if someone needed to go out and fight the fight, my mom was probably better at that than I was. She'd go out and grab people in the hall and drag them into the room. But I knew that
being a woman, it's easier to do that.
I'd get arrested if I did that. No, the problem was that I think, Nicole, at one point in time, I told you that I felt like I had a PhD in porphyria because for 10 years I did nothing but study porphyria.
Yes.
I would read all the boring medical journals. I would sit down and talk to the doctors because we were involved in numerous studies. So I had the opportunity to talk to people who made their career out of basically researching this rare disease. And I'm one of those that makes a living reading extremely boring stuff, so I'm pretty good at it. So I absorbed everything that I could. So if we were sitting there in a hospital room and a doctor's coming in and he's asking questions or he's talking to himself, more often than not, I could answer the question. I could tell him, yes, this is what's happening. Here's the medication she can't take, and here's why, because it's processed on the P450 pathway, and she has a deficiency in that pathway because she's not producing it. You go into the whole biochemistry aspect of it. Then all of a sudden they ask you what your profession was. And I said, well, I'm an accountant. But it's
He's
merely
like, "Wow, you
because
sound
out of
like a geneticist,
yeah.
biologist."
No, I'm a forensic accountant. I bust people for a living, but in my spare time, I read medical articles. So I spent a
Wow.
lot of time digesting all this information and spitting it out whenever it was necessary. But I also had a pretty good memory about classes of drugs that she couldn't take. And part of the problem is every patient is a little different. So even though one patient may not have a problem with this drug, I knew what she had problems with. And if they were wanting to give her, let's say, for example, gabapentin, I knew she had a very serious reaction to gabapentin. So for whatever reason, it didn't work well with her. But everybody wanted to try that because it was a non-opioid. And the the belief then and as it is now is that the fewer opioids probably the better. So they were trying something a little bit different to try to address the pain. And I would always have to say, no, you can't do that because for whatever reason, it's for her, it just doesn't work that well. It puts her basically in a catatonic state. And I would remember
Oh my God.
all the other drugs that were definitely listed as no-nos for people with porphyria. And I would find out that when you entered a new hospital, they would regularly, just as a matter of course, give like a 5-drug cocktail that involved everything from anticoagulants to, because that's what they did for anybody that was going to be in bed for X amount of time. And I would have to go through that list and say, no, no, no. Why are we doing this? Why is it really necessary? And question all these things, which you don't make friends real quick when you walk into a hospital and you start doing that. But I would try to have my little elevator speech that from a pharmacological standpoint, less is more. And if we could get away with putting less things into her body, we were probably better off because you never do know what kind of chemistry set you're creating there at the end of the day. So you want to be very careful and only use what's necessary. So that's the kind of thing that we would run into each and every place. And it was always a fight because then I would hear something about, well, it's hospital policy. And I'm like, well, that's not my problem. It's not my policy. you know, don't make your problem my problem. So
You're like, I have enough problems.
So with all that in mind, I mean, just knowing your backstory and you having that PhD in porphyria, as a caregiver that's watching or listening to this right now, who might not maybe have the bandwidth to get a PhD in porphyria or the time to do it, what advice would you give them to just be the best caregiver, just based on your experience and you going through all of that?
well, I mean, I'm not going to advise anybody to get a PhD in porphyria. I'm OCD as the day is long. So that's just the way I am. Uh, I didn't do it to be better than anyone else. That's how I deal with stuff. Uh, if I walk into a situation, I don't want to be the person that knows the least about something. I want to know at least enough to know if the person I'm talking to knows what they're talking about. So that's why I did it. That's how I cope with things. So I don't think it's a necessity by any stretch of the imagination. You need to know some basics. You need to be familiar at least where there are drug lists available that you can check so that when new things are prescribed or new treatments come up, that you at least can have a secondary look, because the assumption is the doctor knows all and they're going to take care of that for you. I mean, honestly, they're seeing how many patients in that hospital and they've got how many different problems they're dealing with. A second set of eyes can never hurt. Um, it's about taking care of the most number of patients the most effective way they can, and that doesn't necessarily mean they're going into the most granular detail on the do's and don'ts for each and every patient. Just in the case of porphyria, when someone, or at least in the case of my ex-wife, when she was in bad shape, the last thing we needed was another piece of wood to throw on the fire. Because we could take a 3-day hospital stay and turn it into 6 or 7 real fast. So I was very careful to look at what was being given, and if there was something that seemed to be contraindicated, I would at least want to talk to somebody and have them explain to me why it was necessary and how it was not going to be a problem. That didn't mean that she didn't always. That didn't mean that they didn't keep from giving. I didn't keep them from giving her something that she shouldn't have had in some cases, but more often than not, if it was something that seemed to be a big no-no, there was a little bit of a fight before we came to a conclusion. I wanted to make sure they knew what in the hell they were talking about, quite frankly. So that's one. Two, I mean, I was with my ex I'd known her since I was 14 years old. So we knew each other pretty well, and I knew her mannerisms. I knew little things about her that could indicate that something was off. Honestly, I could tell when attacks were coming just because of slight mood changes, certain tics, certain things. There were certain triggers or indications that there was something coming. And more often than not, that was the case. I would say if you're talking about a loved one, keep an eye on them, because you can kind of see changes happening. And maybe there are certain things that can be done to ward off a full-fledged attack. I know when she started to go downhill, we would shift over to higher carbohydrate diets. We would limit some of the things that she might do that might, or in the past, triggered attacks. And be patient. That's probably the biggest thing. Understand that when someone is in tremendous amounts of pain and has a fairly significant and nasty chemical process going on in their body, that they may not always be rational, and you've got to be able to be tolerant of that and accepting of it. So that's the main thing. I mean, you're there to help. It doesn't mean you need to be a punching bag. Doesn't mean that you're there to take care of all that ails them, but you're there to help guide them along the process and be a shoulder to cry on, and to do what you can do to help in their care. And that varies upon every individual's ability.
And I think I like how you broke it down into pretty much those three simple steps in a sense. Obviously, when you deep dive into it, it's not that simple. But I think when people think about caregiving, people think that they're signing this death sentence with their life. Life is so short. Now I'm doing this. I mean, I love this person, but I'm going to be tied down by this. And I think if they looked at it the way you did, I think it's just a lot better way of thinking.
Now, with that being said, I was going to make a disclosure, because I'm going to say, let me start at the beginning. The question was always, did porphyria cause the end of my marriage? And like I said, probably 10, 12 years ago, I would have said no. But I've got a good decade behind me. So I'm sitting there looking back and I go, well, there's no way that didn't play some role. And was it entirely somebody's fault? No, I think it really falls somewhere in the middle. And part of the issue is that if you are a patient as sick as my ex was, she had to be so reliant upon me for so many things. And to a certain degree, there's a little bit of bitterness, I think, that gets bred in that situation if you have to rely on someone for basic needs. So I want to say that I shifted, even in my own mind, from spouse to caregiver, not a spouse that was caregiving, but as my primary role, my primary function, my primary relationship was as a caregiver. And I think that's a death knell for a relationship at the end of the day, unless you're just going to continue to have a caregiver patient type thing. And that's not what a marriage should be. So I would say that is a as a caregiver and a patient, that's something you need to be wary of, and you need to focus on doing couple things, doing normal stuff. And even when one person may not feel like it, there's a certain amount of care and nurturing for the relationship that needs to occur in addition to the caregiving aspects for the patient. Oh, that's my little bit of marital advice. So you see how successful I was at the end of the day. But I think it's a helpful thing to be aware of.
Absolutely. You know, I just wanted to ask you, you've given some good advice on how to be a better caregiver, you know, from your experience. What advice could you give to somebody to be a caregiver and like you said, nurture whatever relationship, whether it's, you know, mother, daughter, it's a marriage, whatever it is, to take time for yourself so you can, you know, they say, you know, you need a full cup before you can help someone else. And obviously with all that, I know it's almost impossible to do so, but what what worked the best for you to find time to, and it sounds like you didn't take care of yourself, and that was a very bad thing. And I think that's something that everyone should heed and remember, that no matter how much you love someone and want to take care of them, you have to take care of yourself. Do you have any advice for caregivers themselves on how to actually take care of themselves?
You know, it may seem selfish, but attending to yourself and your physical and mental needs are critical. Because it will. I mean, you use the cup. I use the airplane analogy. You got to put the mask on yourself before you do the people you're caring for next to you. If you're not taking care of yourself, you're never going to be able to take care of the person next to you. And that's the key. And I think there is a certain amount of mental care that has to be done, because so much of caregiving is not just being there for the physical needs, like taking somebody to the hospital, making sure they get their medication, making sure they've got food on the table and clean clothes and all that. It's also being there and helping lift spirits and helping, if it's a spouse or someone you've got some sort of familial relationship with, you are helping foster that relationship by reminding them why you and them are together, what, you know, reasons to be alive, reasons to go on. And this is something that's not really talked about too much, but at times her health was so bad that she was begging for death. And I don't think that was just her being emotional. I honestly think she was begging for death. And you've got to help them see that there's something else beyond what you're experiencing at this very moment. And that requires a certain amount of mental health for yourself so that you don't get drugged down with them. And that's awfully easy to do, especially if you're in the trenches with them day in and day out, because you're seeing the same thing you're seeing. And that was a tough thing to do. That right there, finding the stuff you enjoy. What brings you joy? What is it that makes it worth you getting up and doing what you do every day? It sounds simple, but it's something at the time I completely neglected, and I know a lot of other people that neglect it as well. You know, there is the dirty little secret is that the rates of suicide amongst people with acute porphyria is pretty high. And there's a reason for that, because life can seem very, I mean, at certain points in time, things seem insurmountable. The bad seems so bad that it's never going to get better. But as a caregiver, at least in my role, I wanted to try to impress upon her that, remember 2 weeks ago, things were pretty good. It's going to be like that again. And as a caregiver, I had to keep my own mental strength up, because I had to remind myself to remind her. And I had to remind myself things were going to get better. And that got to be really tough over a period of time. And I think that's something that, as a caregiver, you got to focus on those things that bring you joy, the things that get you up in the morning, and find something that gets you away from kind of the day in and day out caring for another person. You got to care for yourself some. I don't know. The biggest thing I think I learned in the whole process was patience. And yeah, I'm very linear in my thought process, but being patient and being able to take emotion out of something. If she was screaming at me for some reason, or upset, she was in terrible pain, or the emotions were raw from her, I had to remind myself that may not have anything to do with me, and you can't take it personally. And that was something hard for me to come to grips with. But I don't know, over time, I think it was something that I got better at. And that's something, as a caregiver, especially for someone with a disease like this, I think you've got to expect and be prepared for.
Wow, I just, Warren, a couple times during this, I've had to stop myself from crying, because when I was really sick and my mom and dad were there for me, I didn't understand how hard it was until they got sick, and makes me
Yeah.
appreciate what they did for me so much more. I, of course, couldn't have appreciated it anymore. They saved my life. But you just really, you really went through a lot, and I think it's going to be really helpful for people to hear everything that you said. And so thank you for being so vulnerable and opening up, and because I know, like you said, it wasn't easy. And you're just, I know you're a great person, because I know you were friends, but I just think that you really gave us a great idea of the day to day, the in between, the big picture, the small picture, in a very short amount of time. So thank you for that.
Oh, you're very welcome. I hope that it made sense at the end of the day. Like I said, there was so much. You're encapsulating so many things that happened in such a long time into a short amount of time. I feel like I'm missing half of it, but I don't know, if you guys tell me that it made sense and conveyed something important, I'll believe you.
Well, I mean, that's just the thing is, I think a lot of porphyria patients out there just, I mean, it's you think selfishly. I mean, that's just kind of how it is. It's just this fight or flight thing to it, and you go to the hospital, you're like, oh, I feel like I'm dying, I need to get better, but nobody thinks about the people surrounding us ever. Like, I just, even in the years that I've spent time in the hospital, I just never thought about all those people that came to sit at my bedside, until you really just shedded light on all of that, and just what other people go through outside of somebody with porphyria and caregiving to that situation. So I definitely appreciate you opening up on here, to say the least.
Yeah, well, I mean, here's the secret. As a caregiver, you feel guilty about thinking about yourself, because we are focused on the patient. The patient's the one in the hospital bed. That's the one we're supposed to be worried about, right? But like I said, if you're doing this long term, you got to be able to step back and take a look at yourself in the situation, to be able to make sure that you attend to your own needs and not just the patient's. It's a hard lesson to learn.
I think that's a good place to wrap up. I think there's going to be so many people out there that are going to be so grateful that we had this conversation with somebody that's on the outside looking in and trying to figure it all out. So definitely appreciate you coming on, and yeah, I just greatly appreciate it.
Yeah, thank you so much,
Anytime. I
Warren.
hope it's not. I hope it's cohesive enough that people can follow it and it didn't pop around too much. But
Thank you for taking the time out of your day to listen to our podcast. If you enjoyed this episode, please share it with friends, family, or anyone who could benefit. And please don't forget to subscribe and leave a review on your preferred platform. It helps us spread awareness, and we would be extremely grateful. You can also follow Rarely Discussed on Instagram, YouTube, as well as TikTok. If you're someone seeking diagnosis for porphyria, visit porphyriafoundation.org to receive a free doctor packet, forms for free DNA testing, and a list of doctors in your area. Stay tuned for more episodes of Rarely Discussed.